Orthopedic health information brought to you by Professional Orthopedic Associates.
Hello, I'm Dr. Gregg Foos. I'm here to talk to you today to give you an overview of anterior cruciate ligament injuries to the knee. First, a thing or two about me. I work for Professional Orthopedic Associates. I'm a board-certified orthopedic surgeon with specialty fellowship training in sports medicine. That means that I do a lot of knee and shoulder arthroscopic work, and my specific focus is on athletes and sports injuries. Next, about the anterior cruciate ligament. The anterior cruciate ligament is an injury to the knee, which typically occurs in young athletes. The vast majority of people who have these injuries are aged between 15 and 25 years old. These injuries typically occur with some type of a twisting mechanism to the knee itself. 70% of these injuries occur in non-contact fashion, so most people are not actually being hit by someone when they actually have the injury. This is a very common injury and has become more commonplace as our society has changed to become more involved in sports, and so many of our young athletes are playing at a higher level than they used to be. Approximately 80,000 of these types of injuries occur per year. Oftentimes the injuries result in extended course of care and treatment, and many of these injuries come to surgery. Let's first talk about what the anterior cruciate ligament is. The anterior cruciate ligament is a ligament within the knee joint that connects the femur and the tibia. This model here is a typical knee joint. If I flip the kneecap down, you'll see the femur above and the tibia below. If I bend the knee downward, we know the cruciate ligaments are two stabilizing ligaments inside the knee. These are the main stabilizers for the knee. The anterior and posterior cruciate ligament will cross back and forth inside the knee joint. The anterior cruciate ligament really stabilizes the knee from coming forward, from the tibia from coming forward on the femur. When I get into injuries to the anterior cruciate ligament, typically, as I said, these will come from some type of twisting mechanism. It's quite common they occur when an athlete is trying to decelerate and change directions at the same time. I typically talk about this as being sort of a perfect storm of things that come together to cause an injury to that ligament. As all the forces come together and the ligament tears, typically the athlete will feel something immediately. Usually there's a pop that they describe inside their knee, and the knee typically will give out or buckle on them. At that point in time, that's usually the end of the day of sports for people. The knee typically swells quite a bit because the anterior cruciate ligament, when it tears, it has a blood supply to it, and there's bleeding inside the knee joint afterwards. So quite common occurrence is a very stiff, swollen knee that the patients have difficulty ambulating or walking on. Most of these require some type of medical treatment, and the vast majority of the people with these injuries end up being seen at a hospital or walk-in medical clinic. Oftentimes their x-rays really don't show any type of an injury. Since the ligament is soft tissue and does not show up on the x-ray, the bony structures really appear normal. Many of these are misdiagnosed early on, and fortunately the awareness and of the typical injury itself and the awareness of the society as far as seeing more of these types of injuries have now brought our focus onto them. Once the injury occurs, the typical follow-up is that the swelling inside the knee resolves as the body resorbs that fluid. The funny thing that will happen for many people is their knee starts to feel more normal over the next 3 or 4 weeks after the initial injury. And certainly some people who don't seek medical care or who are not treated by someone who understands these injuries oftentimes will feel as if their knee is returning to normal function. You don't need your anterior cruciate ligament to necessarily walk and to do straight ahead things. The bigger problem that we see is that when people attempt to try to go back to playing sports, oftentimes they will see a situation where their knee will start to buckle or give out on them. These are episodes that we call pivot shifts, such that if they attempt to turn or pivot quickly, the knee will buckle or give out on them, and that oftentimes recurs as far as the swelling inside the knee and the disability that people see. So people who don't seek medical care immediately oftentimes do later on when they continue to have problems in these episodes of instability to the knee.
This has been Orthopedic Health Information brought to you by Professional Orthopedic Associates.